Welcome back. Well, babies' first few days on this planet are filled with questions and concerns, and especially for the parents who sometimes wonder what we should be feeding them, how much should we be feeding them. Well, here to provide some answers is Dr. Wise from Intermountain North Valley Pediatrics.
Yes.
The obvious answer to this is breast milk, but not every mother can provide breast milk. So what are the other options?
Breast milk really is the very best thing to give a baby, and then using some infant formulas from the infant formula companies are great options to use. I don't recommend using anything other than really the infant formulas, as those are formulated to help that, but breast milk really is the very best thing to do.
So what about like coconut milk, almond milk, those kind of things? Is that not for a newborn?
Those really aren't for newborns, and you can end up with some really bad protein losing enteropathies with that, so bad diarrheas and different things like that, and the babies just won't thrive, and it becomes almost dangerous, honestly.
Okay. And Dr. Wise, babies, after they come out of mom and they go home, they're expected to lose a little bit of weight, but not too much weight. How much would we expect them to lose?
So most babies will lose a couple ounces. When they're born maybe at 7 pounds or so, and then they'll drop down to about 6 pounds, 5 ounces, 6.7 ounces, somewhere in there. Up to about 10% is normal. If they do more than that, then that's dangerous.
And by about what time should they regain that weight that they were born at?
We like to see them regain that weight by 2 weeks of age. I like to see them after they come home from the hospital or after they've been born, at least 2 days after they go home. I often see them at 48 hours, and then again at the 2-week check.
Okay, so some babies are born with jaundice too, and a lot of that has to do with how they're eating and things. Explain how that works.
So if babies get overly dehydrated, if they aren't eating as well, then they can get more jaundice, and the jaundice is just that bilirubin that builds up in the blood, and so sometimes they get in trouble with that. So making sure that they're well hydrated and eating well is important in that process as well.
Okay, that's Dr. Wise, and mothers and dads and families have a lot of questions on this subject, and so we have a phone number up there. That's 877-908-0680. Call now. Some people are standing by to answer your calls.